Namaste everyone, I am Dr. Abhaykumar Gupta, consultant Apollo Hospital Blood Center. So today I'll be discussing World Blood Donors Day, why it is celebrated, what is the importance of World Blood Donors Day. As we know, we have seen many patients like thalassemia, sickle cell anemia, hemophilia. These patients require blood on a routine basis. Monthly they require a lot of blood transfusion. At Apollo Hospital, Navi, Mumbai, being a tertiary care big hospital, here we have lot of road traffic accident patients, lot of elective surgeries, lot of deliveries, and sometimes after delivery there is something called as postpartum hemorrhage. In this also patient require a lot of blood transfusion. So here at Apollo Hospital we rely on voluntary blood donors. We organize lot of blood donation camp. We ask patients relative to come forward and donate voluntarily for their own patient and for the benefit of the society. So why this World Blood Donors Day is celebrated? So we had a scientist, Mr. Karl Landsteiner, who discovered different blood groups like A, B, and O. And he was also awarded the Nobel Prize for the discovery of different blood groups. So his birthday was on 14th of June. So to celebrate the cause of voluntary blood donors and to give respect to Mr. Karl Landsteiner, every year 14th June has been celebrated as the World Blood Donors Day. This year's World Blood Donors Day theme is the act of solidarity. As we know, in Ukraine and Russia, there is a lot of conflict going on, and we are having a lot of casualties, and these patients require a lot of blood. So the World Health Organization has put the theme as the act of solidarity, so that we can help the different patients in different subcontinents. And here at India, we are celebrating the World Blood Donors Day. Many of the times people say that people hesitate to come forward and donate blood. They say why they should donate blood. There are a lot of donors, there are a lot of patients' relatives, they can come forward. But patients' relatives are managing a lot of things. We don't want that they have to arrange the blood donors. We want that whenever a patient is getting admitted, without asking the patient's relative, the blood should be available in the blood center. And that will be only available if we have lot of voluntary donors who come forward and donate blood. So on 14th June of 2022, I request all the voluntary blood donors, all the eligible voluntary blood donors to come forward and donate. As per the national guidelines, we need only 3.4% of the Indian population who should donate only once a year, and all our requirements will be fulfilled. As per the national blood transfusion data, which is available of 2017 and 18, India collected 11.9 million whole blood donations, and still we had a shortfall of 1.9 million, which is roughly around 21 million. In a Lancet journal, which is a very reputed journal, they said that world is having a deficit of 100 million blood donations, and out of that 40 million is in the Indian subcontinent. So we want to fulfill this gap. We want that whatever the patient need and whatever the eligible donors are there, we should try to connect them, and whatever the patient needs are there, these needs should be fulfilled on time, and none of the patient the transfusion should never be delayed for any of the patients. And I myself I'm a regular blood donor. I have donated a lot of blood and platelet. I have donated more than 80 times. We have a lot of blood and platelet donors who have donated more than 400 times also. So donating blood is just an act of altruism. You are helping patient. Blood donation is not going to affect your health in any way, and in a long term, if it is going to cause anything, it is going to help at least spiritually, mentally, and physically also if you become a regular blood donor. So I invite all the blood donors to come forward and to go to their nearest blood center, to go to Apollo Hospital Blood Center and donate blood, and keep on donating. I urge all the blood donors to become a voluntary regular blood donor. It is not that you donate only on the International Blood Donors Day or the National Blood Donors Day. We should try to become a regular blood donor, and we should donate every 3 months or whenever the need is there, or whatever is feasible for you. So please come forward and donate blood. And thank you for all the blood donors, and sincere gratitude from the Apollo Hospital Blood Center to all the blood donors who have been donating regularly for our patient and to other patients also. Thank you very much.